Welcome to One-on-One. I'm Steve Adubato. It is our honor to have back once again Barry Ostrowsky, who's President and CEO, RWJBarnabas Health. Good to see you, Barry.
Thank you. Pleasure to be here, Steve.
While we are both big Yankee fans, as is our president, Neil Shapiro, we'll put that off for a separate sports segment.
I love it. Can't wait.
But not everyone's doing as well as the Yankees as we're taping right now.
That's true.
Let me try this one. At RWJBarnabas Health, one of the things that we've talked about offline as well, because in fact I have done executive leadership coaching and run some seminars within the system, and I know that this concept of social impact is important. What is the social impact initiative, and where is it focused?
It is very important, and the truth of the matter is, Steve, this is really an opportunity for us to expand our mission. Historically, as you know better than anybody, healthcare delivery systems dealt with conventional healthcare and clinical services. But we also know, and we've studied it for more than 20 years, that social determinants, frankly, the elements of poverty for the most part, unemployment, lower education, food insecurity, bad housing, these are things that actually contribute to, and for the most part, create bad health in our communities. And so while we've concentrated on clinical care historically, we really haven't concentrated on these social determinants of bad health. For Barnabas, for RWJBarnabas Health, what we've now decided is our mission includes addressing these social determinants.
So, one example.
Unemployment. We have in vulnerable communities, and Newark, New Jersey is in fact an example of that. There is chronic unemployment. People who would like to work don't have the education or training to get and hold a job. So we believe it's our responsibility to take these people, train them, and offer them employment.
Excuse me, Barry, is that the Higher Newark Employment Ready Boot Camp? Is that one of the examples?
That's one of the examples of that. So we just had our third graduation yesterday.
What's it like? What was it like?
There's not a dry eye in the house. These are people who have been chronically unemployed, who desperately would like to provide for their respective families, don't have the training necessarily to conduct an interview, don't have the training to hold on to a position of employment. And what we do is we take these folks and we put them through, as you say, a boot camp that starts with how to dress, how to speak, how to act in an interview session, and we guarantee them a job afterwards. And now in the previous two graduating classes, we have a 99% retention rate in terms of their jobs, and we've actually had 3 promotions. People who had entry-level positions who've now been promoted. Now, we're not doing it alone. We are the primary sponsor, who is an enlightened leader of that city, and he has encouraged us to do this. But other major corporate sponsors, PSE&G and others in Newark, are guaranteeing employment slots for the graduates of this boot camp. So you get into the boot camp, you absolutely know you're going to have a position.
But Barry, what strikes me, and we've talked about, again, talked about this offline as well, in seminars and community gatherings. Explain to folks, they say, wait, it's a hospital. It's a hospital system. By the way, the footprint of RWJBarnabas Health is?
9 counties, 5 million residents. So we believe, a responsibility to greater than half the population of New Jersey, just through our existing locations and facilities and clinical programs. You see, Steve, this is the conversation we're now having. There's a difference between health and health care.
What's the difference?
The difference is healthcare typically is meant to mean the clinical services that we deliver, but the health of a community is a very different picture, sadly, particularly in our vulnerable communities. Our job, we believe, our mission as we now have adopted it, is to deal with the health of the community, not simply the delivery of healthcare services. You need both, obviously.
Right.
You need to deliver healthcare services. We would meet our goal aspirationally if we kept our communities healthy, and frankly, they needed fewer healthcare services.
That's ergo RWJBarnabas Health.
Exactly. It's not
just a branding thing.
And it's not simply conventional healthcare delivery. Now, there's a couple of ways to look at this. We think it's a mission point. We think we have to invest in our communities to, in fact, enhance their health and daily activity and happiness. And to me, that is almost a righteous calling. But if you don't care for that analysis, there aren't enough resources in the healthcare delivery system globally to take care of everybody. So we can't stop people from developing conditions and illnesses there won't be enough resources to treat all those who rely on health care. So to a certain extent, it's counterintuitive to business. If we keep people healthy, they're going to seek fewer of our services. It means less revenue. But that's the mission we have. That's the business we're in. That's the commitment we've made. And we're going to stick to it, even though, in fact, it is, as I say, somewhat counterintuitive to business. I think it's one of the great examples, candidly, of an enlightened board of trustees. We are blessed in our organization with volunteer trustees who've distinguished themselves in their business callings. They're community leaders and thought leaders. And when we get in the room and we explain what we think the mission of our organization is, our board embraced it unanimously and with great excitement. So here, in managing a big organization, we're almost a $6 billion a year organization, we believe strongly that investing in our communities, which doesn't have any immediate return on investment, that investment is critical to our success.
But you know, it's interesting, and this isn't just a disclosure, but it's actually a part of the discussion. Barry serves on the board of public broadcasting in the state. He's actually being honored at a gala. We're taping this in June. He's being actually honored tomorrow, but has been a member of the board. You've been a big supporter of public broadcasting as a system. Is that part of impact, social impact?
Oh, I think it is.
As opposed to just sponsorship.
Oh, yeah, no, absolutely. First of all, we're a New Jersey organization, so we believe in things that are New Jersey. And of course, New Jersey Public Television is New Jersey. You know, our state has a bit of an inferiority complex on every topic. And I think it's incumbent upon us as an organization to invest in New Jersey. So supporting New Jersey-focused and based organizations, be they entertainment, be they communication.
Special Olympics of New Jersey.
Special Olympics of New Jersey. These are things, Rutgers University, of which we're a big sponsor. Yeah, real quick,
tell folks that that's not just a branding initiative.
No.
What is that initiative?
You know, we have a partnership with Rutgers about medical education, medical research, and, in fact, the delivery of healthcare services. We are effectively and virtually partners in helping New Jersey enhance its level of medical research, enhance academics, at the same time make available top-line clinical services throughout the state.
Last question. As a leader of this very large, the number one, the largest healthcare system in the state, how much do you sit there and say the status quo will never be good enough and we have to constantly find, I don't want to be esoteric about this, but as students of leadership, I ask, how much of your role is to actually ask, what is our next move? Where do we need to be? As opposed to, we're good where we are, let's stay there.
That is the dilemma. I mean, the truth of the matter is I think my job is not to maintain the status quo. People, and you've done it to me as well, have asked me, so what keeps you up at night? and I'll tell you what keeps me up at night. Not the daily pressures and concerns that you typically have in a business like ours.
Like paying your bills?
It's an operational issue, negotiating with other parties. My concern is that with all of the assets that we have and with all the opportunity we shall fall short of what we can accomplish. And that's the issue. So when you go to work every morning, to me, what drives you is, so how do we accomplish that next aspirational goal? How do we make more of a positive impact on our communities? That's the tough part of the job. And so, but it's the job, frankly, that we love.
Barry Ostrowsky is the president, chief executive officer, RWJBarnabas Health, a huge Yankee fan, whether they're winning or not. But we're taping in loyalty. That's right. We're taping in June, so things are good.
So
and
far,
this will be seen after that. You'll figure out where it is. But by the way, Met fans should watch as well. Listen, thanks, Barry.
Thanks, Steve. Always a pleasure.
Stay with us. One-on-one. We'll be right back.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by TD Bank, the New Jersey Education Association, JAG Physical Therapy, Horizon Blue Cross Blue Shield of New Jersey, Johnson & Johnson, the New Jersey Office of the Insurance Fraud Prosecutor, and by the law firm of Gibbons PC. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. One-on-One with Steve Adubato has been produced in partnership with TriStar Studios.